Hello, in this video we're going to discuss exceptionalities and as they are related to diversity in education. So let's just jump straight into it and start to talk a little bit about what these exceptionalities are. And so I've listed kind of the three main categories of exceptionalities, which are the physical, which is also called psychomotor. You also have social or behavioral, and then you have cognitive and intellectual. Physical, obviously, are things that are physical in nature, so being blind, being deaf. There's also some medical conditions like cerebral palsy or cystic fibrosis or things like that that have a medical diagnosis that may end up with the student having lung problems, having vision problems, having hearing problems. Some of these may be that the student has to walk with a walker or end up in a wheelchair, so they're very physical in nature. The next set are social or behavioral based. So autism, again, is more of a social disorder, while emotional behavioral disorder, EBD, is more of a behavioral disorder, and ADHD commonly falls within the kind of behavioral category. Then you have cognitive or intellectual, and the word cognitive just means anything related to learning or thinking. So that's more of like learning disabilities or mentally intellectual disability, which we used to call mental retardation, but that kind of has a negative stigma to it, so now we often call it MID. And there are different levels of that, so more severe versus a lighter version. And that's kind of where things like Down syndrome, things like that fall into. While dyslexia, learning disabilities, more of the mild form, fall under learning disability or LD. Also, that's where gifted falls into, and we'll discuss where that falls in just a second. But so you kind of have those three different areas. This list is not exhaustive. There are many, many, many more types of exceptionalities that you'll run into, some very unique, and some of them that are pretty common, but I didn't list them here. Also, all of these disorders and disabilities have continuums. So like looking at autism, you have high functioning autism and you have low functioning autism. High functioning autism they may just be a little bit socially awkward. Low functioning autism, they may not be able to speak at all. They may be nonverbal. So you have a continuum with all of these different disabilities. Someone with cerebral palsy, they may be fine. They just have difficulty writing or holding a pencil on the mild form. On the more severe form, you may have students who are bedridden or have to be in a wheelchair. So again, a big continuum there. Every student is unique, so even when you're looking at characteristics of each of these, you have to keep in mind that every student is unique. And some of these affect academic progress, which is the cognitive and intellectual groups, but some of them affect more of behavior or social skills or physical movement. So again, a disability doesn't necessarily always mean they're going to have trouble learning or doing their schoolwork. It may be in another capacity. Also, there's some overlapping in these categories. For example, speech or language disorders. It could be that the student has trouble physically, so they have issues with their vocal cords, their lips, where they put their tongue, their teeth, like a physical disability. Or it could be a cognitive disability where there's a disconnect with the words going from their brain out through their mouth. It's more of a cognitive thing. Same thing with traumatic brain injuries or TBIs. Those are normally caused by like falls or severe seizures that leave the person having a brain injury afterward, or car wrecks, things like that. So they're obviously very physical in nature. You have a legitimate brain injury, but it can lead to cognitive impairments such as having the ability to learn, retain, memory issues, that kind of thing. So some of them do overlap. Also, it's very hard to define exceptionalities, but if you really wanted to just bullet right down, it's students who have exceptionalities often learn differently than the norm. And so just using the word norm lets you know where some of this conversation is going, is what is the norm. In diversity, in multicultural education, we are now learning that there's different norms based upon gender, based upon race, based upon ethnic background, based upon all these different diversity categories. We all look at the norm differently. So that is kind of a conversation to be had about exceptionalities, is are we all on the same playing field when we're talking about them based upon our different norms? But disabilities happen to be exceptionalities that when students are finding things more challenging, so they're finding learning, physical demands, or social skills more challenging. On the other side of the spectrum is gifted, which is normally found in the cognitive intellectual domain, but those students find normal activities less challenging, so they're kind of on the other end of the continuum. For the most part, when we talk about exceptionalities, we use the word disability because it's a lack of skills in physical, social, or cognitive, but on the other end is gifted, where it's like having over skills. So that's where exceptionalities come into play versus diagnosed disabilities. Also, your book talks a little bit about students who are quote unquote at risk, and those are students who have a higher risk of having or developing a certain disability. So they haven't been diagnosed with the disability yet, but they're at risk for it. And so a couple of risk factors are students who are already struggling academically, socially, or physical, but haven't been diagnosed as being disabled. So maybe they're falling a little bit behind grade level. The teacher may say they're at risk, meaning we need to catch them up. We need to do some interventions before they do fall behind and maybe before they are diagnosed with having a learning disability. Also, if they're falling behind on a developmental scale, especially when you have young children who are going through these milestones in their life of being able to walk, being potty trained, that kind of thing, if they're not hitting these milestones within reason, sometimes they might be labeled as developmentally delayed, which may put them at risk for having some type of disability. Also, if a student has disabled siblings or disabled parents, that there may be a family history of it, and that may or may not put them at risk. Some things are not at risk. Obviously, a traumatic brain injury was an accident, so it's not like, just because somebody in your family has a traumatic brain injury, you will. But certain disabilities do have a family history and a genetic link to it. Also, medical issues may put you at risk. Things like being born premature, having not the quite nutrition, being abused, especially early in life, can sometimes cause a student to be at risk for different types of disabilities. And again, having a developmental disability, which is normally what they group all students under until they're age 5 or older. So if you have a 3-year-old and and you think they have some type of disability, normally they are hesitant to label them with a specific disability, learning disability, MID, whatever, without letting them grow a little bit. So normally they'll just categorize it as a developmental disability until they reach age 5 or older. So students who are at risk, why it's important for a teacher to know is because there are specialized services that can help these students at risk, and sometimes it can avoid them having to go into special education. So things like intensive pre-K, physical therapy, speech therapy, that kind of thing, they can all start those before they actually are school age, so before the age of 5, and sometimes that will help them if they're already at risk. Now, before we get too far into this conversation, let's discuss disability as a social construct, especially in the viewpoint of multicultural education and looking at all these different diversity subgroups. Because again, we're trying to define what a disability is, what an exceptionality is, and we want to question as we do this, are there different cultural practices and beliefs that may label someone as disabled in the U.S. system, but not labeled outside if they come from another country? Also, are there certain cultures more likely to accept disabilities more so than the U.S. is, and think of them as an individual difference? Or especially like Native American culture, they believe that diversity is actually promoted, so they would not look down on a disability, not that we do in the US, but they wouldn't look down on it. They would see it as a gift from like a higher being to have this special whatever it is, and we look at it as a disability. So you kind of got to keep it within the cultural constructs there. Another example of this is males and minorities are more likely to be labeled as having disability than any other group, culturally, gender-wise, anything like that. So our thought is, and what we need to question as teachers is, you've always heard, well, that's just the way boys are. That's just how they are. So is that really true? Is it that or is it that how they behave and what they believe doesn't align with our mainstream centric curriculum that we talked about before, and so we call them disabled because they're not aligning with our viewpoint? Do they truly learn at a different pace and in a different way than we typically teach, or are they disabled? So are we just saying, listen, this is how we're doing teaching, this is how we're doing education, and you don't fit in that and you don't learn that way, so therefore you must be disabled? Are they really disabled, or are they just not fitting in this mold that we've set for them? And so again, the question here is to keep thinking is, what does the disability need to look like in order for it to be real? And how much of an impact must it take on one's education before it is taken seriously? Could it be, again, with social, okay, maybe they're just a little bit awkward, fine. But at what point do we say, this is really hindering their ability to become a whole person, to grow, and to progress academically, so therefore now we need to take some preventative measures. So just a couple of things you need to think about as a teacher. So that leads us into the conversation of labeling students with disabilities or not labeling students with disabilities. And there are kind of pros and cons to each. There isn't a definitive response because there are people on both sides of the viewpoint here. But when you think about labeling, think about also, again, this cultural background of are there certain subgroups who are more likely to be affected by being labeled, especially those that belong to a certain subgroup where the social relations are a big part of their culture, especially when being different is being bad. So kind of in our U.S. culture, we kind of have a mainstream. If you're gifted, that's usually looked highly upon, but and I almost hate to say this, but sometimes we do look as a culture at disabilities as a negative thing. And so are American students more likely to suffer by being labeled as having a disability than in another culture to where it's looked highly upon to have a difference, be it a disability or not? So are there certain subgroups that are more likely to be socially hindered by being labeled? Now, as of right now, it is important to note that students must be labeled in the U.S. with a specific disability in order to receive educational services. So right now, as the structure works, students do have to be labeled and diagnosed with LD, MID, autism, whatever, to receive these special services. So we are kind of pro-labeling right now, but the conversation kind of is, for those who are against labeling, they believe that the pro for not labeling students is that obviously they're not stigmatized by their peers. Obviously, they are maybe not going to fall into learned helplessness, which I'll talk about in a second. The con there is that they might not get the special services that they need because we haven't labeled them as having a specific disability. Those who are for labeling and believe that we should label students with disabilities, the pros and the cons are kind of opposite. The pro for labeling a student with a disability is knowing what their strengths and weaknesses are. You have autism, so therefore, for the most part speaking, you're going to have trouble with this, and you're going to be a strength in this. You're LD in reading, so this is where your weaknesses are going to be. This is where your strengths are going to be. You can know a lot about a student by their disability. Also, we have some information to be able to research and compare those with similar disabilities. The con, though, is when you label somebody with a disability, there's that social aspect of being shunned by your peers by having a quote-unquote disability. Also, when students know they have a disability, they sometimes will fall into what's called learned helplessness. And learned helplessness is kind of when a student gives up. So a couple of quotes that kind of sound like learned helplessness is, I'm not doing well in X, Y, and Z. I'll never do well. I've never done well, so therefore I give up. Or I have this disability, so therefore I obviously cannot be successful, so I give up. And so they're learning to be helpless, and they're learning to not try to achieve. They're learning to let somebody else do it for them. And again, they kind of lose motivation and aspiration, which disability or not will affect a student's ability to be successful. So sometimes labeling with a disability can bring about that learned helplessness because they say, you know what, I've been labeled with LD. I'm obviously stupid. I obviously can't learn, so therefore I'm not going to try, which is not true. You can have LD and absolutely learn. You just may learn differently, but sometimes that doesn't translate the same way to other students. So let's look kind of at a historical perspective of exceptionalities and how we've kind of dealt with students with disabilities in the past leading up to now. So really, rights and specialized instruction for students with disabilities really didn't come about until the 1970s, which really isn't that far in the past if you really think about it within context. So before the 1970s, states and schools actually had the right and often did deny students who had disabilities, be it a physical, social, or mental. Oftentimes it was physical or mental in terms of academics that they felt like was too significant for them to handle. So they would say, hey, Miss So-and-so, your child is just too far different than our normal students. They learn too slowly, or they have too many handicaps, and we just can't teach them. You're going to have to find somewhere else to teach them, either teach them at home or find a special school for them. And they had the right to do that. Often those that did have mild disabilities, um, were in the school system, but they still didn't receive the education that they needed. So you still had students who maybe had a learning disability who didn't look different or act different than the other kids, and so they were still included into the school system, but they didn't receive that specialized instruction that they receive now, and so they often fell further and further behind, and then oftentimes they quit school and thought of themselves as stupid because they couldn't learn, when in reality they were not. And so the more severe students were often separated from their peers in a special class, and so that kind of led to a lot of the labeling and a lot of shunning there that was going on. Those special classes often did not have the appropriate resources, staffing, or curriculum to meet the students' needs, so it was kind of like babysitting, or getting them ready to work at a retail job or getting ready to do something, a low skill job that they would never be able to go to college or actually have a career. And again, the goal was to kind of keep them separate and teach them life skills rather than try to get them back up to speed and in the regular classroom. The idea was you have a disability, you'll always be different, you'll always be separated, so let's teach you completely differently and don't even try to mainstream you with other students. Also, if they weren't making progress with the norm, they were often labeled as slow learners or a behavioral problem, so they were labeled as quote unquote bad, which came with the stigma. It was always that the student was the problem, not the instruction. So it wasn't the way that we were teaching them. If they didn't learn the way that we taught, they must be slow learners or they must have behavioral problems, other than the way we think now of, if you're not learning the way that we're teaching, we might want to change our teaching and just see if you learn in a different way. And so that leads you to question, what would have happened if we changed the way we taught? So instead of teaching a certain way with these students not getting it and therefore being slow learners, what if we had changed our instruction back then? Maybe those students really weren't slow learners, they just learned in a different way. So for examples of this, the idea often, and it's debatable, is that boys have a tendency, especially young boys, have a tendency to be more active than girls. So if the regular classroom looked like sitting down, listening to a teacher talk, writing on chalkboards, obviously boys are probably not going to respond to that as well as girls if they're more active and need to be touching things, moving around, that kind of thing. If girls are more likely to sit down and listen, they're probably going to do better in a typical educational classroom that teaches that way. But if we had changed that and if we had made it to where we did do more active activities, were the boys just as likely to be successful? And so were they likely to avoid having these slower or being a disturbance stigmas? And so was it again more of the way that we're teaching rather than the students themselves? So here are some pictures of classrooms in the past versus classrooms now, and I just want you to kind of see and compare them. So on the left side, these obviously are classrooms in the past. So look at these pictures and think to yourself, what type of instruction is going on here? So you see the teacher sitting behind the desk, students sitting in rows, reading books, not really talking to each other, looking down, writing or reading. No seemingly activity going on. And the picture below is the teacher reading to the students, and it looks like they're reading with her or they're maybe answering questions. So what type of student is going to do well in this situation? Well, obviously someone who can already read, obviously someone who can already write, obviously someone who is an independent learner, which if you remember back, U.S. students are more likely to be independent learners. If you had diversity students who work better in groups, they're obviously not going to be successful here. Also, you have the student who is being punished by saying, I will be good, and wearing a cap. Is that really effective punishment? What is the student really learning from that other than just being shamed? Are they learning how to be good? Are they learning what they did wrong in the first place? So again, look at that instruction versus look on the right now, which are some classrooms in current day settings, and think about what types of instructions go on here and who do you think is going to learn best in this environment, and just look at the students. Do they look overall more happy? And so you see the special balls and the special beanbag chairs. That's a new kind of thing going on in public schools now called flexible seating, which is we have all these specialized seating options, and as long as you're doing your work, you can pretty much sit in any of those options. We're not making you sit in a desk. We're not making you face forward. We're letting you work collaboratively. We're letting you sit in beanbag chairs. We're letting you sit on these bouncy balls. As long as you're comfortable and you're doing your work, we're okay with it. Also below, you see that the students each have their own individual laptop. That is the idea of personalized learning, which is each student is learning at their own pace, at their own rate, based upon the information that this teacher is feeding to them through the computer. The teacher is still there. You can see her in the back walking around helping students individually through their schoolwork, but again, they're all working at their own pace, rather than if you look again to the left, it looks like everybody's reading from the same book at the same time. Well, there may be students here that are struggling. There may be students here who are gifted and have already read that whole book by the time the teacher's on the third page. And so you're trying to make people stay together when they're all uniquely at different places. Versus now with technology, you have personalized learning to where students can be at different paces due to the technology. So again, comparing and contrasting these different type of instructional approaches, and think about if the student had a disability where they were more likely to be successful. So continuing on with our conversation about the historical background related to exceptionalities, moving back, going back in time a little bit, we had the big Brown versus Board of Education of Topeka, which you know from the racial conversations. That was in 1954, and basically the judgment was that separate is not equal. We cannot have separate we cannot have separate races in different schools. We cannot separate by race. Everyone must be educated on equal terms, and so often that is thought in the context of race. However, this started the conversation for those who were disabled, saying, if separate is not equal, does that mean that you should really be separating students with disabilities, even the minor disabilities, and giving them not equal resources and teaching them on the level that they need? So separate is not equal, does that also include disabilities other than just race? So it kind of started the conversation. And so in 1972, there was a case of the Pennsylvania Association for Retarded Children, or PARC, versus the Commonwealth of Pennsylvania, and it found that students with special needs were not uneducatable, which is what we had kind of thought in the past, and that students with special needs should also deserve a free, appropriate public education, or a FAPE. We've talked about that before, and that students with special needs have the same rights and protection under the law as any other child. So it begins to make them more equal at this point. So then moving forward in 1975, we have a landmark case, which is the All Handicapped Children Act, and it's been amended several times, and now you'll hear it called IDEA, or Individuals with Disabilities Act. That is something you will absolutely hear a lot about in the future. It's kind of one of the main acts and policies for special education students. And so it kind of helped us moving from these ideas of, okay, students are separate but equal is not okay for diverse students. Those who have disabilities are not uneducatable. So how do we make sure that they are being educated? So it tried to help to define how and what responsibility the school had in making sure that these students with special needs are given that free, appropriate public education. We've decided that they should have it, but how do we give it to them? And how do we make sure schools are doing what they need? And so they gave 6 different principles that this is based upon, and it's zero reject, non-discrimination evaluation, free appropriate public education, which we talked about in a minute ago, least restrictive environment, due process, and shared decision making. And we're going to talk a little bit about each of those, but again, all of this is geared towards making sure that each school system, each school is giving the students with special needs what they need to have a free, appropriate public education, to have a good shot at learning as everyone else would under their same rights and protection under the law. These principles are pretty simplistic though, so we'll just kind of go through them really quickly. The first one is zero reject, which again is what it sounds like. No students can be rejected. So there is zero reject policy on rejecting students. They cannot be denied an education despite disability. Each state must locate, identify, and evaluate all students under the age of 21 for special needs services. So they can't turn them away. Now, you may say, well, how is this possible? Say that you have a district that has a lot of students with special needs, and they need all these different things. They need wheelchairs, they need wheelchair ramps, they need specialized parapros, they need assistive devices. How do they make all this happen if they can't turn somebody away? Well, the schools are often given federal money based upon the number and the need of the students with special needs. So if you report, and they have to report, I have this percentage of students with this disability, they get funding based upon that to help kind of negotiate the costs that are needed to help with that student's education. But they can't just say, you know what, we don't have anything in place right now, so you're just going to have to go somewhere else. You cannot reject students for that. Also, there has to be a non-discriminatory evaluation and identification. So the schools or the parents can request that a student be tested for special education. The parents must consent if the school is the one initiating this. You can't just go and test the student for special ed. The parents must consent or waive their right to consent. And the assessments that they use, the testing that they use, the IQ test, the behavioral test, all that kind of stuff, must be non-discriminatory and multifactored. So that means, remember our conversation that we've had previously about cultural diversity in testing. So they have to be very careful with that. Again, since the majority of those that are being tested and diagnosed are going to be minorities as well as males, we have to make sure that those tests are not unfairly judging them. Also, you have to use multiple test activities and assessment. One test is not going to cut it. You can't give them an IQ test, say, oops, you didn't do well, you must be special ed, here's your special education services, this is your disability, and keep it moving. They're very careful about making sure that they are evaluated appropriately, and that when they do label a student, they're pretty sure that it is actually what they say it is. The third one we've talked about a lot is a free appropriate public education, which basically means that parents cannot be asked to pay extra for the special services. Again, federal money can be given, but you can't say to a parent, you know what, your child's in a wheelchair and we don't have a wheelchair ramp, so you're going to have to pay to get a wheelchair ramp if you want your child to be able to come in and out of this school. Or you know what, your child has cerebral palsy, he's not able to feed himself, so you're going to have to pay for a parapro or a nurse to come in and feed him every day at lunch. You can't ask the parents to give any money to give the specialized instruction that the student needs to be successful. And so your next question would be, okay, if we're going to give this student who has special needs a free appropriate public education, how are we going to give him, again, an appropriate education based upon his needs if he doesn't, or he or she doesn't fit in with the normal curriculum and what a normal student would be doing? That is when comes into play that each student getting special education services will have an individualized education plan, or an IEP. And you will hear a lot about IEPs within the context of special education. And it is essentially a document that is created by a team from the school. It's reviewed annually, and the main purpose of an IEP simply is to define how much of the regular education the student's going to follow and how much he is going to follow this individualized plan that we're setting for him, because he's not capable of following the regular curriculum. So really, there's a lot to an IEP. You'll hear a lot about it, but really, if you want to boil it down, it's basically, again, a plan that where the student's going to go by this plan rather than go by the formalized curriculum, because he's shown that he's not being successful in the formalized curriculum. So why sit here and make him try to go through that and not learn anything? Let's make a plan for him to learn at his rate in his time, and at some point he may catch up to the regular curriculum. But again, instead of trying to push him into the regular classroom with everyone else doing the same thing, doing the same curriculum, doing the same work, let's instead make a plan for him that will work because it's based upon his needs individually. So let's talk a little bit more about the details of an IEP. So again, it's individualized, so it's made just for that one student based upon their specific needs for their education, and it's a plan, so it's a roadmap of how we're going to teach that student. So who is involved in developing the IEP and the IEP process? The student's parents or guardians are obviously involved. They kind of have to be involved. You'll have one regular education teacher, usually they're the student's current teacher or like last year's teacher. You'll have one special education teacher, usually the one that works with that grade level. Usually you'll have a principal or someone who is kind of have administrative power, who's going to be able to supervise this and make sure that the student does get the services that they need. If they need to purchase services, then they have the decision to make to decide on the funding and that kind of thing. So someone who kind of has administrative power, usually the principal. And then usually you have a counselor or a school psychologist, which is someone who is used to interpret the results of any testing that are done. And then the student, if appropriate, usually at the high school level, they'll try to include the student, especially when they're making a decision on how to transfer, how this IEP will transfer into college, or how that they will use how this student will transfer outside of high school. So those are the people who are involved in the IEP. And so again, the IEP is a living document that is edited by the authors if the authors agree. So it's something that is going to be edited. You're going to look at it every year and you're going to make decisions as to, okay, this is where we are this year. What do we need to edit for next year? What are we going to move to till next year? So every year at least they're going to meet and make decisions for the next year. But they can meet again. If something's not working, they can meet again. And if they all agree, they can change the document. So what is going to be in this document? One thing is the student's present level of functioning, which is going to be documented by the teacher and by the specialized test. So we want to know where the student is in terms of reading, in terms of math, in terms of history. If we're saying the student is LD, a learning disability in reading, is he 2 grade levels behind? What can he do? What can he not do? Is the problem in comprehension? Is it in fluency? Is it in vocabulary? What is the actual problem? If the student has a physical disability, okay, what can he do or not do? He can hold a pencil, he can walk, he can feed himself, but what can he not do? Can he use the restroom himself? Can he clean himself? Whatever it is. So again, this could be behavior. Can the student handle being in a regular classroom among 10 different peers? Okay. Can he handle being around 2 peers? Can he handle not acting out every 5 minutes, or is it more like every 10 minutes? Can he handle having, sitting in a classroom for an hour without making a disruption? So what is the present level of functioning? And then from there, which obviously the level of functioning is going to be different than the norm for that student, which is why the student, for that group of students, because that's why the student's getting an IEP. And then, so what are the annual goals for that student? So for the year, what are the goals and the objectives? And normally they look at these per 6 to 9 weeks. So we have overall goals of what we want you to do by the end of this year, but then we have goals for every 6 or 9 weeks of this is how you're making progress to those goals. And the goals must be measurable. It must be the student, normally they will say the student will be able to compare and contrast X, Y, and Z. The student will be able to not have a disruptive outbreak every hour. The student will be able to hold a pencil and write for at least 10 minutes or whatever. It has to be measurable to clearly be able to say the student can do this or they can't do this. So moving on from that, they're going to determine what specialized services or interventions the student's going to need to be able to reach those goals and for what. So are they going to get extra time on test in math? Are they going to be pulled out for language arts 3 days a week for 30 minutes a day to kind of help them catch up to reach these goals because they are behind in reading, which speaks to bullets 1 and bullet 2. So what interventions are they getting and for what? And then they're going to ask who is going to provide these interventions. So is it going to be the regular education teacher is going to give them special timing? Is the special education teacher going to get involved? Is it going to be that they're with the special education teacher most of the day? Is it that they're there with the regular teacher most of the day? Are they getting pulled out? Is the special ed teacher coming to them? What's kind of the plan here? And then again, the last thing is that they're going to define how those learning goals, which we talked about in bullet number 2, are going to be measured. So every week we're going to do some type of an assessment to show progress per that goal, and then we're going to meet every 9 weeks per se to kind of see are they meeting those goals and do they need to be adjusted. So again, the whole purpose of an IEP is to define where the student is right now, their present level of functioning, where we want them to be, which is their goals, how we're going to get in there by determining what the special services are going to be and who's going to provide them, and how will we know when we get that student there, again, by the measurement of those goals. So that's what a plan is. You're setting forth a plan for their individualized education because they have shown at this point that they are not fulfilling the regular curriculum. Okay, so moving on, we have the 4th principle, which is a least restrictive environment. And if you really think about what that says, it kind of gives you the answer. Students are to be educated in the environment that is least restrictive to them at the capacity that they're able to actually learn and their needs are being met. So the idea is for students with a disability to be educated in a setting that resembles the regular classroom or to be quote-unquote mainstreamed or in an inclusion setting, which means that they're with their non-disabled peers as much as possible. Now, that doesn't mean that every student with a disability is going to be in the regular classroom all day, every day, because it's based upon how much the student needs and how much their needs are being met. So again, the more severe disabilities are not going to be able to be in the classroom all day, every day. Sometimes not at all. Their disability may be severe, so severe that they have to be in a separate classroom, or they can go into the regular classroom sometimes, but then have to be out for other types of instruction. So the least restrictive environment is not always going to be the general education class for everybody. That is the goal, but it isn't always the case. Also, this is a continuum, so it means that students can move based upon their progress. So maybe we start out in a self-contained classroom, so they have no interaction with their grade level peers. But then they get better, so we start letting them go in for lunch, or they start going in for activity, or they start going in for center time. And so slowly we put them more and more in. Sometimes the regular classroom may be so restrictive for that student and the student's so far behind that they're not really learning in that environment, and so they really need to be pulled out or they need to be in a separate classroom. And really what you see happen most of the time is students who have the milder disabilities tend to be in the least restrictive environment. So those who maybe have a learning disability or have a slight form of autism are often in the regular classroom, or maybe they get pulled out if they have a learning disability in reading. They're pulled out for special help in reading, but they don't stay in the classroom the whole time. But for the most part, they are in the general ed classroom. Those that are more severe, so you have severe autism, so, nonverbal, or you have severe, like MID, to where you have students who are 4 or 5 grade levels behind, who can't read at all, who can't speak, they're nonverbal, that type of thing. You see them more in separate self-contained classrooms, kind of away from their peers, because functionally speaking, they're not learning with their peers. They're that far behind, so we need to meet them where they are. So that's kind of where this continuum goes. So this was a really great graphic that kind of showed you at the bottom of the pyramid is the general education classroom, or what we call inclusion. So if you look at the red dots are meant to represent students with special needs, and the green dots are representing the non-disabled peers. So inclusion, they're all intermixed, and that's the least restrictive environment, mainly for those with really mild disabilities. And most students meet this qualification. So if you notice that the bottom of the pyramid is the largest piece, most students have mild disabilities. It's very few that have that severe and profound of disabilities. And these are mainly the mild disabilities that we've discussed kind of in this module. At the top, you see, is the most restrictive. They're never with their non-disabled peers, but very few students actually meet that qualification. It's those that have severe and profound disabilities. And so you can kind of see where the different tiers are. So one thing that I just want to clarify, because I don't know about your background in knowing these different things, one is when I keep saying resource or pullout. And so resource or pullout is a type of instructional setting where there's a separate room where students receive instruction individually or in a small group with people with those similar disabilities. And so what will happen is they'll be in the regular classroom, and then they'll be pulled out by the special ed teacher, and they'll be either worked with on an individual basis or with a group of other students on kind of their level. And they'll go to it for a part of the day, so they're kind of back and forth. More severe than that is the self-contained classroom, where the students stay in that separate room all day, and all of their instruction is by a special education teacher. But oftentimes in self-contained classrooms, there's a lot less students. So you're talking maybe 10 at most students with similar disabilities are in there. So a resource pullout is we're kind of back and forth. I'm getting a resource, I'm getting a pullout for my specific needs, or, be it reading, math, whatever. Self-contained is I'm in there all day, every day, and that's more for a little bit more severe disabilities. Okay, so moving on to number 5, principle number 5 of IDEA, which is due process. And essentially that just means that students have to go through a process to be diagnosed with a disability. So we can't just up and say, you know what, you have a disability, that's the end of story, and keep it moving. So parents have to be included in the process. They have to be notified in writing before any decisions are made. They have to give permission for testing. So for any testing that goes on, they have the ability to access any records and any documentation related to this process of diagnosing of the disability in special education services, and they have the right to have hearings if they disagree with what the school decides. So again, the whole point of the due process is to avoid students being labeled or diagnosed with a disability prematurely, just saying, you know what, you don't learn the way that we teach, so therefore you have a disability and you're going to be labeled with this, and all the negative potential things that go with that, as we've just discussed before. And so it's making sure that we have taken all the actions we need to teach the student in different ways, and therefore the only other potential cause as to why they're not learning is they may have a disability, other than just saying, you know what, you don't fit in the way that we're doing things, so you must therefore have a disability. So think back to our images in the past of the ways that we used to teach in the past and how we used to have a huge overdiagnosis of special needs in the past by saying, boys, minorities, you don't learn the way that we learn, or the way that we teach, so therefore you must have a disability, you're going to be in a separate classroom, we're not going to meet you at your needs. But again, probably the real reason was we weren't teaching in diverse ways. So that's what the whole point of having a due process is to make sure that we don't label students as special needs when really they just need to be taught in a different way. So how do we avoid this overdiagnosis of students into special education services? That is something called, we use a process called response to intervention. It's relatively new. It actually came out right when I was going to school. So we're talking about 2009-ish is when it really kind of hit schools, and it was all, I remember when I was doing my student teaching, we were all trying to figure out what it means and what it works and how it does. So it's relatively new, so about 10 years old, but we call it RTI. And again, this is just like IEPs. This is something that you'll hear a lot when you're talking about and hearing about hearing about special education. So you have kind of a pyramid again, and there's different tiers. So tier one is the regular classroom instruction, or sometimes there's 3 tiers. Sometimes you'll see 4 tiers. It depends on how the school system does it. So either tier one or below tier one is the regular general education classroom. That's where everyone gets the same instruction, learning from the state standards that we've talked about, everything same. Say that the student isn't progressing, they're falling behind, they're at risk, they're not learning, and they're having difficulties. Okay, so they're showing signs of struggling. So at that point, I move that one student to tier one, which means he or she can get some differentiated instruction, which we talked a little bit before, learning in a different way. So maybe we give them more one-on-one time. We put them in groups. We pull them to the side. We do these little interventions to try to give them a little bit more help. So what happens if that works? Then that's great. They go back to the general curriculum tier. What happens if that doesn't work? Well, they need some more intervention, so we're going to move them to tier two. Then in tier two, they get even more specific supports. That's why we're going up the pyramid. It's getting more and more specific. So they get more specific supports, so small group instruction, that kind of thing, but they're still in the regular classroom. And so what if they start doing better? Great, they go back to tier one. Maybe they'll eventually go back to general education. If they're not doing better, then they go to tier three. Then in tier three is when they start to qualify for special education services, because at that point they've shown you've went through all these interventions, you went through these different tiers, and you're still not learning, you're still not progressing where we want you to be. So we've tried all these different strategies with you. So it isn't an issue of our teaching style or the way we're teaching you, so it may be something else. So at that point is when the student is involved in testing by the school psychologist, IQ testing, behavior testing, that kind of thing. The IEP team, which we talked about before, starts to meet to develop individualized plans. But at that point, we've decided that an individualized plan is best for you, not just a matter of could we change our instruction a little bit, because we've documented from tier one and two that we've tried all these different strategies, we've tried to be more individualized, we've tried group work, we've tried all these things to try to help you, and you're still not progressing, so let's give you more individualized instruction. So again, these tiers are fluid. If you're doing better, you move back down. If you're doing worse, you move up. And again, it's a pyramid, so most students are in the general education. Tier 1, Tier 2. Tier 3 is only special needs students, which are again the smallest part of the pyramid. So it's less likely students are going to move all the way up the pyramid, but they can move back down based upon their progress. So here's another indicator of what it is. This response to intervention, or RTI, can be for academics or for behavior. So it's not just for academic learning, it can be for behavior strategies. So the pro with doing all of these things is that it helps students not get unnecessarily diagnosed for special education. So that's a huge thing, that we're not just saying you don't learn the way that we teach, therefore you must be special ed. It's we have all this documentation of all these different strategies we've tried, and we're seeing that you're still having trouble, therefore we would like to give you some special education services. The con to this, the con to RTI, which is something that a lot of teachers complained about when it first came out, is it takes a long time for students to go through these tiers, because sometimes there's a time marker to where students have to stay in each tier 3 to 6 weeks to really get enough data to really see if this is really effective. So if you're staying in each tier 3 to 6 weeks, it may take half a school year to get you up to where you need to get special education services. So a teacher, especially a veteran teacher, may come in and say, you know what, I know that kid's going to end up and need some special education services, but I can't give it to him immediately. I have to put him through RTI, which takes half a year to get him through it, to get all this documentation for him to even be considered to get special education services. So sometimes it seems like it's taken longer than it's needed, and students are again sitting here for half a year not getting services that they need because we're having to document it. So again, just to kind of review the RTI process again, everyone starts at the bottom of the pyramid, which is the regular education classroom. If they're not improving, they move up to the next tier. If they do better, they stay in that tier or they move back down, which is always the goal, is to move down the pyramid. If they continue to struggle, they move back up the pyramid. The tiers are getting more intensive with more individualized instruction as you go up. But the goal is for students to slowly move back down the pyramid. If they make it to the top, needing the most intensive intervention, that is when they are tested for special education. And again, each tier is providing these different instructional strategies because sometimes a change of instruction is all that is needed. And as they're moving through these tiers, teachers are having to keep data on each tier of how the student responded, what they responded with, that kind of thing, so that students, so they have data for like 3 to 6 weeks. So if they are tested for special ed, there's a lot of data to back up that we tried this, it didn't work, we tried this, it didn't work, which again speaks to the pro and con of it's helping students not get unnecessarily diagnosed for special education, but is also sometimes taking a long time for those who do need it to actually get the services. Okay, so the last principle of IDEA is shared decision making, which is easy enough that the parents and the students, when appropriate, especially in a high school setting, are encouraged to participate in the decisions related to the IEP, educational goals, placements. They're always included in this. It's not just the teachers and the parent and the principal making these decisions. Now, sometimes you have parents who will waive their rights and they don't want to be involved in it, or they're kind of absentee parents, and they'll choose not to get involved with it. And if they do waive their rights, then the teacher and the principal are able to make decisions. But if they don't waive their rights, the parents do have to be included in all of these decisions. That's why it's very important that they understand all these principles. They understand RTI, they understand least restrictive environment, they understand the IEP process, because if not, again, very easy to get confused and overwhelmed. So finishing up with our historical background, moving forward, we have 1973, which is Section 504 of the Rehabilitation Act. And you'll hear this often, especially with ADHD students. You'll say, well, they're not considered special education, but they have a 504 plan. That's what this means. And it basically means that students cannot be denied or discriminated on based upon their handicap. And it also brought into the idea of getting accessibility requirements. So if a student needs a special aid, if they need a parapro, if they need a wheelchair ramp, if they need a technological device to help them speak because they're nonverbal, that is where some of the federal funding came in, and that's where some of those aids are able to be purchased, which was under Section 504. Also during 1973 was the Americans with Disability Act, which kind of expands beyond education, which was the idea that anybody with a disability cannot be discriminated on in general for employment, public service, transportation, accessibility, and buildings. So if you go into any public building, notice things like courthouses, things like that, they all have wheelchair ramps, they all have ramps and things like that, because all public buildings have to be accessible for students and for people in wheelchairs. You have to provide transcription for different things, for audio and visual, because of those with those disabilities. You can't be discriminated on based upon any disability you might have in terms of employment. So that kind of went beyond education. And so a lot of these fed into yet another landmark thing that you'll hear often about, which is the No Child Left Behind Act, which was in 2001. It's most commonly associated with the Bush presidency. And that, in addition, added that teachers should be highly qualified, which means that teachers have to have the correct education and certification background. That's why you have to go through an education program to be certified to be a teacher. You have to take certain certification exams, which you all will. To become a certified teacher, you have to be quote unquote highly qualified to be able to be a teacher and again, this is based upon making sure that you know what to do to teach these types of students. Also, schools have to show adequately yearly progress, which does factor in students with disabilities. So they have to show where the majority of the students are moving forward towards their goals, including special needs students. And so they look at the IEPs and say, are the majority of your students that have IEPs working towards their goals and making progress? And so that is also, so annual yearly progress is tied to federal funding. So if your school's not making annual yearly progress for special needs and for regular education, you could get a dip or a cut in federal funding. And so again, very important for the schools to make sure that they're making progress so that they do get the proper funding so that they're able to continue to function. So that is an outlook on the exceptionalities. There's a whole lot more to it, but again, this is just kind of scratching the surface so you know where it kind of is and where it kind of falls when you're talking about the diversity of learners.